Welcome to SourcePoint's presentation on Medicare Advantage plans. In this video, we will walk through the rules, costs, coverage, and restrictions associated with Medicare Advantage plans. We will also provide an overview of Medicare savings programs, the low-income subsidy, also known as extra help, and discuss fraudulent or unscrupulous sales practices. Our goal is to give you clear, helpful information so you can better understand your options and feel more confident navigating Medicare-related decisions. Let's get started. When someone becomes eligible for Medicare, they generally have two options for how they receive their benefits. The first is Original Medicare, which we are calling Option 1. The second is a Medicare Advantage plan, or Option 2. You may also hear Medicare Advantage referred to as a private Medicare health plan or Part C. Medicare Advantage plans are offered by private insurance companies that contract with the federal government. These plans receive a fixed payment for each enrollee and are responsible for providing that person's Medicare-covered benefits. To enroll in a Medicare Advantage plan, beneficiaries must meet specific eligibility criteria. Understanding these requirements helps ensure they choose the right coverage. A beneficiary must be enrolled in both Medicare Part A and Part B. It is also important to know that someone cannot have both a Medicare Advantage plan and a Medicare Supplement plan at the same time. Medicare Supplement plans work only with Original Medicare, which is Option 1. In addition, the beneficiary must live within the plan's service area in order to join that Medicare Advantage plan. For additional guidance, you can visit the National Council on Aging website to review a list of helpful questions to consider before enrolling in a Medicare Advantage plan. A beneficiary still has Medicare if they enroll in a Medicare Advantage plan and must continue paying the Part B premium, as well as Part A if applicable. Although these plans cover the same core benefits as Original Medicare, they may include different costs and restrictions that affect access to care. They may also offer additional benefits, such as nutrition services, non-skilled in-home support, home modifications, and sometimes routine vision, dental, and hearing services. Because coverage varies, it is important to review each plan carefully for details. The most common types of Medicare Advantage plans are Health Maintenance Organizations, or HMOs, and Preferred Provider Organizations, or PPOs. In general, an HMO requires a beneficiary to get a referral before seeing an in-network specialist, and it typically will not cover care from a doctor or hospital outside the plan's network. The exception is urgent or emergency care, which is covered. With a PPO, a beneficiary does not need a referral to see an in-network specialist. They may also choose to see out-of-network doctors or hospitals, but they will usually pay more for those services. Most Medicare Advantage plans include prescription drug coverage, but some do not. Those plans may still work well for people who already have drug coverage through another source, such as the Veterans Administration. Medicare Advantage plans and their costs can change from year to year. Reviewing plan charts can help beneficiaries compare options, understand potential out-of-pocket costs, and make more informed decisions about coverage. For a complete and up-to-date list of plans available in your area, along with specific coverage details, refer to Medicare.gov to run a plan comparison. This chart illustrates how to read a Medicare health plan chart. First, look at the service area. This tells you where the plan is available. To join a plan, you must live in its service area, so it is always a good idea to check with the company to make sure the plan is offered where you live. Next is the monthly premium. This is the amount you pay each month for the plan, in addition to your Part B premium. This amount may be deducted from your Social Security benefit or paid directly. You will also see out-of-pocket limits. The first amount shows the limit for in-network Part A and Part B services. If a second amount is listed, it shows the limit for out-of-network Part A and Part B services. Some plans may list one combined limit for both in-network and out-of-network care. The chart also shows what you would pay for common services, such as primary care visits, specialist visits, chemotherapy drugs, other Part B drugs, home health care, and durable medical equipment, or DME, such as walkers. For PPO plans, a second amount may appear to show what you would pay out of network. Another item to review is the yearly Part D deductible. This is the amount you pay for covered prescription drugs before the plan begins to pay. You may also see whether the plan offers extra benefits. These are benefits that Original Medicare does not usually cover, such as vision, hearing, and dental. Be sure to check with the plan for details about what is included. The chart will also list the type of Medicare plan, such as an HMO, MSA, PPO, PFFS plan, or cost plan. You may notice a member rating for the plan. This rating comes from the Consumer Assessment of Healthcare Providers and Systems, or CAHPS, survey. If a plan does not have a rating, the chart will explain why. This is one of several measures Medicare uses to give plans an overall star rating from 1 to 5. For more information about plan quality and star ratings, you can visit medicare.gov/plan-compare. Finally, the chart includes the plan's name and ID number, along with its phone number and website, so you can contact the plan directly or learn more online. A beneficiary can join a Medicare Advantage plan when they first become eligible for Medicare. This happens during a 7-month initial enrollment period that starts 3 months before the month they turn 65, includes their birthday month, and ends 3 months after. For someone qualifying due to disability, the same type of 7-month enrollment window applies around their 25th month of disability. Each year, there is also an annual enrollment period from October 15th through December 7th. During this time, beneficiaries can join, switch, or drop a Medicare Advantage plan, with coverage starting January 1st. Some people may also qualify for a special enrollment period due to certain life events, such as moving, receiving Medicaid, qualifying for extra help, or living in a nursing home. From January 1st to March 31st, people already enrolled in a Medicare Advantage plan can make one change, either by switching plans or returning to original Medicare and joining a Part D plan. It is important to note that this period cannot be used to join a Medicare Advantage plan for the first time. It also does not provide a guaranteed issue right to purchase a Medigap, or Medicare Supplement, policy. Coverage under a new plan begins on the first day of the month after enrollment. Finally, Medicare gives plans star ratings, with 5 stars being the highest. If a 5-star plan is available in the beneficiary's service area, they may be able to enroll in it. Please note that enrollment rules can affect when coverage starts and what options are available, so beneficiaries should review deadlines carefully before making a decision. Medicare Savings Programs, also known as Medicare Premium Assistance Programs, or MPAP, help low-income individuals with limited assets pay for healthcare coverage. People who do not qualify for full Medicaid may still qualify if they meet income and asset limits. The chart shown here breaks down the different types of assistance programs. QMB helps pay Medicare deductibles, co-insurance, and the monthly Part B premium. SLMB has higher income limits than QMB and helps pay the Part B premium, including possible retroactive payment for the previous 3 months. CHI also helps pay the monthly Part B premium. Countable resources generally include liquid assets such as checking and savings accounts, IRAs, stocks, bonds, and mutual funds. A home, vehicle, household items, burial plot, burial expenses up to $1,500 per person, and life insurance policies are not included. Income includes Social Security, pensions, employment, interest, and similar sources. Eligibility is determined through the Medicaid application, which is available at the County Department of Job and Family Services. Extra Help is a Medicare program that helps eligible people with limited income and resources pay for prescription drug costs. It applies to those enrolled in a standalone Part D plan or a Medicare Advantage plan that includes drug coverage. Eligibility for Extra Help, also called the Low Income Subsidy, or LIS, is based on monthly income and total resources. If you qualify, Medicare will pay all or most of your Part D premium, deductible, and copayments or coinsurance, and it provides full coverage during the donut hole. At this point, the choice is yours in deciding how you want to receive your Medicare benefits. You may be asking yourself whether original Medicare with a secondary insurance plan and a Part D prescription drug plan is the best option for you, or if a Medicare Advantage plan may better meet your needs. Each option has benefits and drawbacks, so it is important to think about your own health needs, budget, and preferences. What works well for a friend, neighbor, or family member may not always be the best fit for you. By taking the time to watch these presentations, you have already taken an important step toward understanding your choices and making a decision with more confidence. The information on this slide is fairly straightforward, but it highlights an important issue. Beneficiaries should never share personal information unless they initiated contact and are confident they are speaking with a trusted source. Medicare fraud and waste have cost taxpayers billions of dollars, which is why it is so important to stay alert to unethical or unlawful practices. If something seems suspicious, it should be reported to the appropriate authorities as soon as possible. This brings us to the end of the presentation. We hope it has been helpful in answering your questions about Medicare Advantage plans, Medicare savings programs, extra help, and protecting yourself from unscrupulous sales practices. If you would like to learn more, we invite you to sign up for one of our in-person classes here at SourcePoint. You can find a full list of class offerings, dates, and times in the insurance section of our website.